I'm Alyssa Rayborn. This is Deliverable 3, Patient C. Okay, so Mr. Rayborn, we are going to start with the neuro assessment. So I know you hit your head. Do you have any pain right now?
My wrist hurts, my head hurts.
Okay. Can you rate the head pain 0 to 10 for me?
5.
Okay. And can you point to where exactly it's bothering you?
Somewhere in here.
Okay, perfect. Can you tell me now what today's date is?
Not sure.
Okay, can you tell me the month?
March
Okay. How about the year?
2024.
Okay, and who's the current president?
Biden.
Okay, great. And you know where you are today, correct?
Mm-hmm.
All right. So I know you've got the head pain. You're mentally intact, neurostatus is intact. So I'm going to take this pen light here and check your eyes, your pupils. Okay, so you just need to follow. Okay, perfect. So everything looks good. Pupils are active, reactive, round to light and accommodation. So Perla is intact. Okay, now do you remember what happened that led to your accident on the bicycle? Do you remember what happened before that?
Car hit me.
A car. Okay. So did you black out at all? Did you pass out? Did you have memory of the entire thing?
No, I woke up.
Okay. So maybe a little bit of a concussion there. So we're going to look further into that. While we're talking though, I'm also assessing cranial nerves. Any particular issues with smell right now? Are you able to smell like say flowers or...
I can smell them.
You could smell? Okay, so you haven't lost any sense of smell. Visual acuity, visual fields all seem normal. Pupillary reaction, extraocular movements are all within normal limits. Corneal reflexes, I mean, with him alert and speaking to me, I can tell that he has corneal reflexes. Facial sensations intact. Can you feel me?
Mm-hmm.
Can you open your mouth and say a few words?
Like what?
That works. Jaw movements intact, facial movements intact. He can hear very well. Can you just just swallow for me? Any pain at all? Okay. Swallowing is intact as well. Voice and speech are all within normal limits. Shoulder and neck movements. Any pain here? Can you shrug your shoulders for me? Perfect. All right. Tongue symmetry, position, and movement. How do you stick out your tongue for me? Lift it up, side to side. Great. We're going to move on. At this point in the examination, I would test reflexes. I do not have a reflex hammer. But I would walk through biceps, triceps, brachioradialis, here and here. I would also do deep tendon reflexes, including patella and shin, just to make sure everything's intact. We're going to say, for the sake of argument, that it's all within normal limits. Anything else we're missing? No?
Wrist.
We're going to get to the wrist after this. So we're moving on to wrist. So moving on to musculoskeletal, we are going to take a look at your wrists. So can you both arms out for me? And which wrist did you injure? This one? Okay. I know they cleaned up your injuries from earlier. Examining your wrist, I can tell that this one's more swollen. There is some redness. Does it hurt when I touch?
Yes.
Okay, so it's tender. Assessing the other wrist in comparison, I can definitely see swelling, edema, redness, warmth, and tenderness. Can you bend your wrist for me? You can't bend this one?
No.
Okay. Can you squeeze my hands? Okay, so definitely weaker on the left side. So we are going to probably get some x-rays of your wrist. Neuro-wise, you seem to be intact, but since you've had a concussion a couple years ago, we're going to keep an eye on you and do frequent neuro checks. Is there anything else today besides your head and your wrist? Oh, okay, great. Thank you.